Good afternoon, teachers. Today, our topic is based on comparing effect of Andrographis paniculata and chlorhexidine mouthwash on anti-gingivitis. Before we get into details, I would like to give you a brief introduction of our study. Dental plaque is a mass of bacteria which start accumulating onto surface as sticky biofilm. Since dental plaque is usually transparent, colorless, and not easily visible, so individual is frequently unaware of quantity and location of dental plaque presented in their mouth. Plaque deposition brings about an inflammatory change on periodontium that can lead to destruction of tissue and loss of attachment. So dental plaque removal is an important issue in health promotion. Gingivitis is the most common oral disease which can occur in everyone. Normally, the mechanical and chemical plaque control are used to remove the plaque. Chemical plaque control like mouthwash is widely used for adjunctive therapy. Chlorhexidine mouthwash is the gold standard mouthwash that used in treatment of periodontitis. Nowadays, people pay more attention on natural products, including the herbal mouthwash, due to the low toxicity, ease of availability, and lack of microbial resistance of herbal agents. Bamboo, triphala, pomegranate mouthwash have been studied for a long time, and advantages of this herb are verified by many evidence. Chlorhexidine gluconate mouthwash was developed in the United Kingdom in early 1950s and introduced into the USA in 1970s. It's a positive charge molecule that might bind to negative charge site on the cell wall. It destabilizes cell wall and interferes with osmosis. In low concentration, it affects the integrity of the cell wall. Once the cell wall is damaged, chlorhexidine then crosses into the cell itself and attacks the cytoplasmic membrane. Damage to the cytoplasm, delicate semi-permeable membrane, results in increase of permeability with leakage of intracellular components. In high concentration, chlorhexidine causes precipitation of bacterial cytoplasm and causes the cell death. The chlorhexidine is the gold standard mouthwash, and its effectiveness can be attributed to its bactericidal, bacteriostatic, and its substantivity within oral cavity. But it still has many adverse effects composed of taste alteration, excess formation of supragingival calculus, soft tissue lesion in young patients, allergic response, and staining of teeth and soft tissue. Adverse effects limit the long-term use of the chlorhexidine. Andrographis paniculata is one of natural products that we interest. From review literature, they claim that the Andrographis paniculata has benefits in many aspects. It's widely used in traditional medicine in Southeast Asia and China to treat various diseases. There are many parts of it can be used, such as from Jarukam John et al. 2010 said that the whole plant can treat snake bite, insect sting treatment, dyspepsia, influenza, dysentery, malaria, and respiratory infection. Other study of Punsap et al. 2004 said that the leaf is for fever, common cold, cough, mouth ulcer, GI disorder, and so on. In vitro study corroborates the antibacterial activity of Andrographis paniculata used in folkloric medicine to treat skin infection. All these extracts were shown to exhibit inhibitory activity against most of the pathogenic bacteria, which caused the chronic bacterial skin infection from Ahmad et al. 1998. It's used as an alternative choice due to its property, such as in anti-inflammatory properties. It's able to treat various diseases such as cancer, diabetes, high blood pressure, ulcer for a century in Asia, America, and Africa continents. And their relation to oral health is the ability of treating oral cancer, inhibitory activity against P. gingivalis, and healing of the recurrent after stomatitis lesion. Nowadays, there's a limited data about Andrographis paniculata mouthwash, which leads to our objective in this study. Our objective is to compare the anti-gingivitis effect between Andrographis paniculata and chlorhexidine mouthwash. Conceptual framework divided into three main streams, which are independent variable, dependent variable, and control variable. Independent variables, which are Andrographis paniculata mouthwash and chlorhexidine mouthwash. Independent variable is gingival index, and control variable are mechanical plaque control, tooth surface, toothbrush, and toothpaste. Hypothesis. Now hypothesis is the mean value of gingival index of Andrographis paniculata mouthwash is equal to chlorhexidine mouthwash. An alternative hypothesis is the mean value of gingival index of Andrographis paniculata mouthwash is not equal to chlorhexidine mouthwash. 40 dental students, College of Dental Medicine, Rangsit University, aged between 18 to 30 years old are our sample group. The study was approved by the ethics committees of Rangsit University, and the subjects were included in the study after signing the informed consent and voluntarily agreeing to participate in this project. About our study procedures, we calibrated the two examiners to test inter and intra-examiner reliability by coherent kappa analysis, and the results were as shown. These two examiners were held all of the examination, who was trained and well calibrated by experienced professor. First visit, all the subjects received oral prophylaxis using Gracie-Hewlett and Sickert scaler by operators and approved by instructors at oral diagnosis clinic. Oral hygiene instruction for modified bars brushing technique was given. The subjects were received toothbrush and toothpaste to use until the end of the study. They were told to rinse with normal saline solution during this period. Second visit is 1 week after first visit. To evaluate the subject compliance, the subject were requested to return all the bottles. At this visit, comprising gingival index was performed. The subject were randomly divided into two groups, which group A is for chlorhexidine mouthwash and group B is for Andrographis paniculata mouthwash. All of the mouthwash were packed in similar color of bottles but labeled differently. After that, randomly administered to the subject by operators. The subjects were also unaware of which mouthwash they had been administered. They were asked to rinse with 15 milliliters of mouthwash for 30 seconds after toothbrushing in the morning and before bedtime. Third visit is 3 weeks after second visit. The subject were requested to return all the bottles at this visit. They were recalled for a second measurement by the same examiner. Oral prophylaxis was done to set a zero for baseline. Fourth visit is 1 week after third visit. Clinical examination and switch the mouthwash from group A to group B and group B to group A. And fifth visit is 3 weeks after fourth visit. Evaluate the subject compliance, clinical examination, and oral prophylaxis was done. The statistic was performed by using SPSS statistic version 25. The normal distribution of clinical measurement was assessed by using the Sharp-Pyrovic test. The efficacy of two mouthwash were evaluated by using the descriptive analysis of mean and median of the score. The mean GI score between groups were examined, and using the Mann-Whitney U test, the differences within each group of GI score were assessed by using the Wilcoxon-Siren test. Result. The gingival index at baseline for both groups was 1.15. There were no significant difference in the baseline gingival index between two groups. The gingival index after the experiment was 1.12 for chlorhexidine group and 1.09 for Andrographis paniculata group. Both mouthwashes slightly decreased the gingival index, but not significant from baseline, and was not significantly different from each other. Discussion. In this study, the gingival index after the experiments, which indicate the status of gingival health, revealed no significant difference from baseline in both groups. Previous studies have shown that chlorhexidine can improve the gingival index toward the better gingival health when used concurrently with mechanical plaque control. Thaosridee and Suk found that the subgingivally delivered AP gel during a supportive periodontal therapy was able to significantly reduce the gingival index in a chronic periodontitis patient with mostly moderate gingival inflammation when compared to the scaling and root painting alone. In comparison to our study, Andrographis paniculata mouthwash did not significantly reduce the gingival index when compared to baseline. This might be due to different type of gingival disease, different preparations, and delivery method that used in the study. Concentration and preparation of AP may also have an effect on the outcome of this study. AP gel, most widely used in previous study, contains 0.56 to 5 milligram per milliliter of AP extract. AP mouthwash contains 0.6 milligram per milliliter, close to gel preparation. Gel form may provide better retention of the substance in the target area compared to mouthwash. Most of our subjects were presented with very mild gingival inflammation that may not show the further improvement after the mouthwash was used. Further research with larger sample size that has more severe gingival inflammation may be required in order to differentiate the effect of chemical plaque control from the normal oral hygiene practice procedures. Conclusion: Andrographis paniculata mouthwash can be used as an adjunctive to mechanical oral hygiene practice procedures and as an alternative to chlorhexidine, especially in patients whom self-performed oral hygiene may be limited. Thank you very much for your attention.
Thank you, Dr. Siriem, for your interesting presentation. That's very good presentation. Is there any question from the participants? So every question are welcome. Please join us. Okay, if no question, okay. Dr. Siriem, could you please tell me more about the Andrographis paniculata? Is there available in Thai market?
For our study, we use with the brand MyBasin for our study.
Oh, okay.
To compare the chlorhexidine from the same brand.
Okay, I think the problem of connection of internet of our chairperson. Okay, wait a minute, please.
Okay, I'm come back. Sorry for everyone. Okay, for my question before, Dr. Siriem, I asked that is there Andrographis paniculata have the Thai name?
ฟ้าทลายโจรค่ะ
Oh, okay. How about the inclusion criteria of its participants in this research? Did they have any good oral hygiene, right? You say that they have mild gingivitis, okay? Is the oral hygiene practice effect for the outcome of this study or not?
The oral hygiene practice that we suggested to our participants, we set for baseline. So I think it has an effect to our outcome.
So
different oral hygiene practice that individual have different.
Okay. And to evaluate the gingival inflammation, why do you use the gingival index instead of breathing on probing?
The breathing on probing is one of the criteria in the gingival index that we use.
So that means you use the breathing index also?
Yes.
Yes. Okay. Okay. Is there any question more? So if not, I have to move